Hi, everyone. So I think we'll get started. My name is Ash McCaskill. I am the programs coordinator at AgeWell and for the Epic AT platform. I will begin by acknowledging my voice kind of sounds like a frog, which is cool. Why not? So I am a little under. I'm doing fine, but I sound worse than I am. So I apologize for my voice if it is hard for anyone with their headphones. But I'm so excited today. I do want to welcome you to today's a webinar on industry and policy, developing and implementing the next generation of care models. I am just jazzed to have Sara Aghvami, who is with us today. And before we start, I just want to begin by acknowledging some access points. So today, before we begin, I just want to let everyone know that today's webinar is being recorded and will be available on the AgeWell website and also our YouTube channel after the event. So give it about 24 hours. There is closed captioning available. So if you do want to use it, just look at the bottom of your screen and you will see kind of like a two CCs, and that's to click. It will show up as white text, but in a black kind of border, if you will. Please also note that this is automated and thus on an occasion, it may not be completely accurate. I do want to make sure that everyone also has a good experience today. So for this reason, we do expect all speakers and attendees to show respect and kindness to all sharing this space. Anyone showing any form of harassment will be removed. There is going to be a Q&A today. So if you do want to ask Sara any questions, please use the Q&A feature found at the bottom of the Zoom. Please know that there are no questions that can be posed anonymously. And also, you can use the chat. And also, if you would like to raise your hand and I can unmute you, and you can, of course, pose your question verbally. We do encourage you to use the chat to share your thoughts and comments, any resources, or to engage with other attendees. And I will be moderating that chat today. And for now, like I invite you guys to all tell us where you're coming from today. Like, for example, I'm coming from Montreal, Sara's coming from Vancouver. So yeah, let me start by sharing a brief bio about Sara. So as director of BestBuy Health, Sara leads a team committed to enrich Canadian lives through technology. In her role, Sara develops strategies and business models through partnerships with academia, healthcare providers, senior living and living care organizations, clinicians, and researchers to drive positive benefits for consumers, businesses, and communities. With more than 25 years experience in retail and leadership, Sara is an expert in solutioning technology, commercialization, omnichannel logistics, service offerings, customer experience, and humanizing processes. As a humanist, Sara is a believer in next generations, abilities, and is passionate about mentoring and coaching youth as the developers of the future. Sara believes staying human and relevant in an industry drives business success and community trust. She is motivated by creating meaningful changes. So I do just want to thank Sara so much for presenting with us today. I can't tell you how excited we are to have you, Sara. So, and I could just go on and on, but I'm going to just give you the floor and I will be off camera. But again, everyone, if you need me, I am absolutely here. Thank you so much. And welcome, Sara.
Thank you so much, Ashley. Much appreciated. Hi, everyone. I'm really hoping to have like a chill conversation with you today. I do hope you do come on and ask me some questions, share any thoughts. That would be super awesome. So sorry about the long bio. I am Sara, with Best Buy for 23 years. It's wonderful being here. Obviously, I love Best Buy, and this is why we keep playing in this space in such creative ways. I also do come to you from unceded territory of the Coast Salish people, also known as Port Moody, if anybody's familiar with BC. So just want to put that out there. So again, thanks for spending your time with me today. I'm gonna go about and share some screens because you don't want to see me the entire time. Who wants to do that? And yeah, and let's get this started. Hopefully you get to see my screen and we can go from there. So we are Best Buy Health, and we do believe in enriching lives of Canadians, of course. A little bit about Best Buy Health. We started about 5 years ago in US. Actually, US started this first, and we got super excited and we started joining the train pretty fast. Our purpose, it's very important to be shared up front. So we are driven by the belief that technology can make life better at any age for any need. And what are we going to chat about today? I'd like to share some of my thoughts before we get started. Hopefully, it makes sense to you too. I want to share with you our journey, a long journey, how we got here, and really what we are talking about today is based on our experience to date. I love to touch on social prescription. I'm sure most of you agree with me when we're talking about it, and the partnerships that are going to make this happen when it comes to technology adoption, and how do we create the right environment for continuous innovations, another topic we're going to touch on, and how do we innovate for impact. So very important. Some thoughts. Okay, so a very rude or early interruption as we start learning about human needs. We very quickly thought, well, how could difficult this could be? We got technology, we got Geek Squad, this should be easy. Let's just bring it into the lives of older adults and help them out. Well, that's very early learning and bruises and bleeding to understand there are so many needs the human beings come with, regardless of the age that you're at. And of course, there's a whole bunch of variety that comes, stems from different phases of aging. And so that's complex. So is caregiving relationships. So as our need change since infancy all the way through, there are caregivers who come in and out of our lives in different forms and shapes, mostly informal, a lot of formal. So those relationships also change as the needs change. Our wonderful healthcare, I'm a happy customer at the end of the day, gotta say. But I do feel sometimes for bad for healthcare because we look at them as a messiah of answers for everything. So this is a part of a chat today is how do we get together and start supplementing some of the gaps? And also acknowledging that thank heavens we have social services today. I can't say the same about some of the wonderful nearby countries, but we have it in Canada. It is important to keep in mind, though, their focus is on mostly essentials, food, shelter, loneliness, and all that great stuff. So, again, just keeping that in mind is also important. And our wonderful land, Canada, it's signed up to grow to 40 million populations very soon. Most of that's been done through immigration. Just to say that we're also increasing the number of older adults in this country. We're at top of the aging chart. So we're aging fast, which is hopefully also means we're getting wiser fast. But my belief is that Canada can benefit from a socialist view when it comes to aging. So we can embrace that a little bit more differently. And we're here to be part of that solution. On the next slide, I'm going to show you what I talked about in the first vertical. So the variety in human needs. When we first got started, a lot of questions got asked of us, like, oh, what is Best Buy Health and what you guys are trying to do? So here's a journey, and this is how I'm going to start it with you. A wonderful team that a lot of research understanding what the needs are as you're looking at the spectrum of aging. And on the top, you see the needs of older adults summarized. This list was long, trust me. And of course, the caregiver involvement at the bottom of the chart. And how does that change through the aging spectrum all the way to the wonderful end of the cycle if we're lucky enough. You can see a lot on the chart. I'm not going to bore you through it, but one thing that's important is the relationship or the level of involvement the caregiver is expected to have. As I mentioned earlier, it's not always formal. There's a lot of informal contribution that comes from different sources. So needs are complex and they do change as we go through our journey. Another level of complexity here that we had to learn about pretty fast was healthcare policies, practices, and funding, of course. And we learned that the hard way, to be honest. We took a program out of Best Buy US. We loved it. It was awesome. Our research partners through AgeWell, SAM3 helped us go through its efficacy. It was the validation of the solution. It was a wellness monitoring solution. We came to Canada. It's like, Canada, we got something awesome for you. It's wellness monitoring. You can let 50 of your caregivers know all at the same time about what's up with you. But I guess the root interruption started very early on. Is that, if this is healthcare, I don't expect to be paying for this. What is this? I have more real health issues than, you're telling me right now. So, and very quickly we started digging into what are who gets involved, where does the funding come from, who are the contributors, who has a hand in this, just to know that we need to be very mindful get into this space and trying to go back into our cave and start really thinking about how we're going to come back out again and hopefully not fail this time. So you're going to sense some level of vulnerability from my side, but it is important for you to understand there are points of failure that makes you help go forward. So it's okay to have that in the part of a conversation as you're chatting on with your peers. So what did we do? Obviously we licked our wounds, went to the corner and said, well, what do we want to be where we go back out again? So the most important factors we took into consideration is what you see in the middle of the screen. We took the person. We took the person in mind and we started studying around, well, what are we supposed to be in relation to this individual? And of course, the focus of today's is older adults and enabling their lives to be better. There are wonderful research expert came in and it's like, well, okay, well, let's learn about health conditions. What are the health conditions, and can we even get involved at that level? And very quickly we learned we don't want to play doctors, so let's just learn what else is there that impacts health conditions, as you see it on the screen. Risk factors obviously are a big component. I don't have to tell you about them, but the physical activity, food we put in ourselves, and the sleep and BMI plays a big role. But are we at that point that we can get involved with people's lives at that level? And when I say we, I'm in Best Buy per se. So we said, well, let's just dig deeper. What are the considerations as we get into health factors? So mobility, meds, of course, brain health, and the very number of complexities when it comes to, into considerations. So even there, we need to dig farther as far as what is it that we can do in this space. And the wonderful yellow orbit you see here is the environment. Is where we felt home for the first time. It was like, well, we do environment pretty well, but what does that even mean? So it splits into two, as you can see on the screen. There's a social aspect of your environment, and there's a physical aspect of your environment. And you'll be amazed once you learn how much your environment impacts the outcomes of your wellness, whether mental, whether physical, and even some of the things you see, more serious things you see in the center of the slide. So this felt pretty good, for us, to play in the aura to say, no, we can do a number of things really, really well. So let's just focus on that and make that meaningful. And to bounce that off, a source of truth, of course, our wonderful partners at AgeWell gave us some sort of guideline on how to look at this. And they published the 8 challenge areas, as you know it. Hopefully, if you do, check out their website. It's really educational. So what you see on the left side of the screen are the challenge areas that AgeWell has published. And those are the things that we looked at. Those are the guidelines we looked at to understand what solutions we're going to put forth. You don't have to take a look at everything on the right-hand side. There's a lot of details in here, but I just here to say for the first time we felt we're onto something. To take this though in a retail environment and start communicating to what we need to go work on is quite complex, right? But we all believe in things have to get like super ugly and complex first before it looks better. So to bring that internally and to have the conversation, we had to super simplify what do we mean by these human needs. So what you see in front of you is pretty much our marching orders to say, these are the things that we should be looking at. These are the things we should, become really good at. So safety. If you're putting that person in the center, in our case being an older adult, how do we support and protect their well-being and keep them safe and secure wherever place they call home? How do we support them with their wellness goals, right? Because we want to keep those diseases at bay as much as possible. When things do happen, because we go through wear and tear, of course, how do we track our matrix? How do we share them with our healthcare teams? And how do we stay connected with the outside world, whether if it's our loved ones, people we like, hopefully like, and of course, a healthcare entity, how do we connect with them from the comfort of our homes? Convenience was a big one, and I'll talk about it a little bit later. But how do we take those chores or the things that just doesn't necessarily have to be done by us out of the equation and give time to other things? And let's not forget about the F word. Fun is always forgotten as we talk about solutions. So how do we continuously just keep being inspired? And I say that with all age groups in mind. We should never forget about having fun in our lives. So how do we play a role in that space? Or you might think it's easy. Your Best Buy, you got all these things in your assortment, so it should be easy to jump into. Well, it wasn't that easy. There were absolutely factors that was getting in the way. We learned very quickly through the many conversations we had, and thank heavens we had access to older adults to have these conversations with, that digital literacy was a problem. The one thing that we're guilty of, and manufacturers are guilty of, they put out like these fancy looking things, and there's no one following it to teach us how it went, how it's going to work. And we're talking to a very intelligent generation here. These are the folks who, anywhere from inventing televisions all the way to fax machines, all the way to microwave, but somebody showed up to show them how it works. We somehow over time that element disappeared. The second factor is, what our team calls it as a cereal aisle of technology. You went in to pick up your cereal, and it's quite overwhelming getting in there. We do have a lot of options. It's a great thing, but it's not if you're new to tech and you just want to pick up a couple of things to get on with your life. And once you do that, is like, well, I picked up these two things, do they even talk to each other? So ecosystems play a role. And it's not always friendly to make them talk to each other. And the last thing, well, two last items is, okay, I got it, it feels good, I spent some money, feel good about it, but who's going to come implement it and who's going to help me how to use it? And lastly, I said all these things, but this is actually going to help me at the end of the day. So this helped us, the gaps helped us understand what we want to be at the end of the day to this environment. Digital literacy was the first one we picked up on. So we said, like, without teaching them the how to, this whole thing is not going to be meaningful for us. We can go build another wonderful solution, but if we haven't bridged that gap, we're guilty of not being accessible yet again. So the amazing team put together a solution that is called BestBuy Digital Citizen. I'm happy to say our first step was a social impact step, and it is free for all Canadians to be used. It is in beta setting right now, so if a couple of things like French language don't work for out for you right now, please know we're working on it. But for what it is today, is incredibly amazing. It's empowering, and if you have anybody you can share the platform with, I put a QR at the bottom right. But the talent the team had, they used an educational framework to make the language simple. They extracted all the technology jargon out of the language. And of course, they also removed this step of memorizing yet another password. So it is an open platform, and we do love to share it with as many of Canadians as possible to start learning how to fish on their own. Um, we had a persona in mind when we started developing. It was Joanna early into her 60s or mid 60s. And I want to say the lessons just didn't come out of blue sky. We spent 3+ years in independent living and senior living space. And we answer a lot of questions. We support a lot of technical issues. But what we learned at the end is 50% of the questions we were asked were tutorials, just the how-tos. How do you do this? How do you do that? Can you repeat what you just told me last week? So those will turn into lessons. And what's great about this platform is because of the wonderful relationship we have with our vendors, the information is always expected to be up to date. How many times operating systems change? How many times the looks of things change? So that's what you can expect out of this platform is up-to-date information with friendly characters, with very simple language that can just let the person get on with their self-learning journey. And yeah, I mean, I'm just so proud of this platform, and I really encourage everybody to have a look. Whether you're an activity coordinator, if you're in services for older adults, or yourself is a tech support for your family and loved ones, do share it on. It's quite meaningful. We moved on to the second part of the hurdle. Okay, well, great. Thanks for setting up the self-paced school. But I still don't know what I want. I don't know how it's going to talk to each other and who's going to do the implementation. So that was another area of opportunity we found for ourselves. And again, we are lucky to be surrounded with so many great internal partners within Best Buy where we can go ahead and do this kind of thing with. So because we identify some of the needs, through the spectrum of care, our amazing team got together and it started picking, trialing, and curating technology as we see makes sense. The beauty about Best Buy is the fact that we're not married to any single brand. We're actually married to all brands, but we don't play favoritism along which brand works them better. It all comes down to its level of effectiveness. Does it work? Is it easy to work with? And can we put lessons together to support the individual for long-term adoption? And if the answer to all those questions, yes, then that's where you're going to see step number 3. We bundle things together to make a one-stop shop and hopefully save hours and some oxygen for a lot of people who talk about what do I need today? This is my problem. I want to take something home. And if people do choose to hire Geek Squad, our incredible Geek Squad agents, to bring the solution home or arrive around the same time the solution gets shipped to your home, we're happy to say those hand-selected agents go through extra training around vulnerability and sensitivity because we do understand these are vulnerable spaces we do show up at. So not only we want the agent to be set up for success, we also want the individual who's receiving such services to feel trusted and comfortable with the service they're receiving for the day. And we made number 5 a choice. It's really up to you if you want to become a Best Buy member. That ultimately will set you up for extra savings and ongoing support. But choice here is important. So again, whether it's a gifted solution or if it's something the individual picks to pick up on their own, is something I encourage people to look it up to. Otherwise, we're looking at a one-time investment here. With that, this baby came out, Best Buy Healthy Homes, which is ultimately turning life, technology in form of a life solution or vice versa. We promised ourselves that we're going to talk about life solutions first, hardware last. And some of the examples and bundles we're putting together, for the general public, starting last year, October, offer such solutions. At least this is among our roadmap. We liked individuals to keep active. And that is one way, and I know and and whether we do it or not is, keeping active is one way to keep the disease at bay. And with healthier Canadians, the hope is that, down the road there is reduced cost to healthcare, so we can repurpose it towards better things, and catching hopefully some of the bad bugs upstream. Medical devices, whether if it's low tech or high tech, smart or dumb, doesn't really matter. It's important that one learns about their own baseline and identify the deviation from the baseline. And hopefully, gets to share that data with their healthcare providers that you see on the next vertical to have that informed chat, and that will hopefully allow for in-time diagnosis and better patient outcome. And if you get to do that from the comfort of your home, what we've done is now reduce foot traffic to the facilities that will allow for more serious conditions and serious health issues to jump that queue and hopefully improve the service level in those spaces. And the wonderful comfort of our homes is not super comfortable without some of the safety features. So we like the person to take control of their home safety, through the use of nice, interactive cameras, smoke alarms, or any voice commands, to be the boss of the home and run it the way they like to run it. Risk mitigation is a fact when it comes to surrounding the home with some of those solutions. And of course, if one chooses to bring their loved ones or their circle of care into the equation, there is an easy process to include notifications to go to them as well. But again, that is a choice that we leave up to the care recipient or person who owns the technology to make. And lastly, who likes chores? I mean, we love to make that easy. The essentials, what if it's meal prep, what if it's like things that keeps your food cold or not, or things that could ultimately improve the quality of life are some of the other things that we've been focusing on. If you remember that yellow orbit around the human, that's ultimately what it's translating to. So as a quick reminder, Healthy Homes, Best Buy Healthy Homes focus is life solution first, hardware last. The validation comes through the collaborations I'm going to talk about. We do work with healthcare and we do work with wonderful research teams. And the key at the end of the day is the option to hire our Geek Squad agents to come in and do the work for them and keep it evergreen if they choose to. These are some of the solutions. This isn't a sales pitch by any means, but just to show you that, first of all, some of our wonderful vendors stepped up. It's like, this seems really interesting. We don't ourselves have, a lot of meaning when it comes to collective solutions or holistic solutions. Let's try this together. So Google was an amazing partner, one of the first ones who stepped up. And really, what all we focused with them on was use cases. What about this Google Hub Max? What about this, Generation 2 screen that we're looking at? What does it actually do? And what are the benefits to the individual? You see the same thing on the right-hand side. So Philips was another wonderful vendor who showed up and showed enthusiasm in this space. And as you can see, there are definitely lots of benefits to having the right light in your home at the right time. And risk mitigation is another one, when it comes to lighting your path, as we do the kind of things we do throughout the night when the light doesn't exist as much. And again, as I mentioned, these are, wonderful add-on options if anybody does want somebody to come up and do the work for them. We all about use cases. So at the end of the day, what we want to get good at, and is probably some of the advice I'm giving to everybody who's thinking about solutioning and then coming up with wonderful innovations that they are, is understanding the benefit we bring into the space where people spend more than 90% of their time trying to be meaningful in that space. So this is how we think about ourselves as we go out and talk about our solutions. And how does this help one age in place? Well, if some of the risks are mitigated, if some of my health matrix is being measured where I am, when I'm versus standing in lineups in different clinics and labs, then that would give me more autonomy to know A, more about myself, B, more about my house, and hopefully spend more time in keeping well and do better things for myself. And why do I say this is my belief is, and again, I don't want to stand here and sound smart, a lot of Scandinavian countries have already moved to this space where social prescription is now including starter kits for the homes. So taking the same flavor throughout the way, being safe, being well, tracking the health is something that our older adults, starting from the age of baby boomers, can absolutely benefit from. It would be wonderful. It's reimbursable, of course. Technology is not cheap. We all get it. But when it's not affordable, it will be wonderful to receive some of that supplement through whether our social services or whichever arm is fighting for aging in place as much as possible. And just a note I drop at the bottom is connection with the outside world, in fact, does combat loneliness and depression, which is another sad thing that we do see in some of the spaces that don't receive a lot of connection love. And have you tried this? Yes, we've tried this in a wonderful collaboration out in Alberta. It was a use case. If you haven't checked it out, please do so. It's called Tech Health Condo. I'll take you through it pretty quickly. But the whole idea here was, we were saying this for quite some time, but Brandon Stratford and Health Cities of Alberta stood out as like, hey, if I go buy a condo, would you come do the kind of things you say you can do? And in fact, this is a planogram our technical guru Henry received from them to start working. Retrofitting was, in fact, a very effective treatment in this space. And we phased it out together as partners. As I mentioned, Brandon Stratford and Health Cities are the ones investing in this space. So we defined the selection criteria together. So this, in fact, wasn't younger, older adults, but 60 years old. She did come with health and mobility concerns. And we decided for phase one, all we do is, I call it stick to the walls. Let's just work on the environment as much as possible to make this a meaningful space for them. And that's exactly what the team designed for the individual. She came in, she had a great time. There were definitely some learnings I'll take you through as well. But that just allowed for phase two to become an option, where we can become closer to the individual, or the project is closer to the individual, and start looking at some other concerns. The moral of the story here is starting with the environment first before we get too close to the individual, and very much work on the needs that they have as opposed to our assumptions of what we think is good for them. Keep learnings where keep to one ecosystem. Again, preaching to the choir. Introduce some small doses. That's definitely one thing we took away. Frequent check-ins is a must. We learned that sometimes tenants just don't want to bother anyone or the individuals on that age group, but we need to effectively go ask a lot of questions to make sure she's okay with everything she's got. The fireworks out of this condo of the tenant's behavior in terms of adoption was she went out and started buying her own technology. I mean, I wish she asked us, we would have given her access, but she went out and bought her own smart toothbrush. She went out and bought her own smart scale. I mean, that was the like most incredible thing we could have seen in terms of reaction of the individual who's seen the benefit of being surrounded with meaningful solutions. With that, I get into some of the key considerations because I do want to give us some time to ask some questions. But I thought it was good to share some of our thoughts as to how we got here. Also, there could be some new companies, thriving companies, trying companies that are looking at this presentation. And I do hope that you do understand that we do come from a place of vulnerability. So we did learn along the way. But one of the things that helped us, I would say midway through, is that the team stopped and say, well, can we just define our why? Can we define our how and what? Because that just helps us tell the story better. And I only recommend the same because it really worked for us. We found our, North Pole, I would say our star as far as what we're trying to do when we go out there. What is our belief? And, what are we doing, to manifest on that belief, which is the how, and what are we doing about it, which are the two things I just told you about for us, and how are we expanding our journey. So BestBuy Digital Citizen, to open up a school to say, come and learn and maximize the use of the technology that you do have today. And of course, here are some bundling solutions that we believe is going to be meaningful in their space. So that was our why and how and what. So, and if you want some inspiration, this is where we got it from. So check out Simon Sinek. He is on YouTube. You can watch this for free. It was super helpful for us. Also, acknowledgement to say, define, this is a busy chart because it is a busy effort, okay? So define your partners and collaborators. I am grateful to Age Well, and I'm going to talk a little bit more about what we've learned and we've taken away from this partnership. But this takes a village to come together. And I'm only lucky that come from an organization that has so many arms and legs and different limbs that can help move this movement forward. Otherwise, this is not just me sitting in a small warehouse and the three of us putting things together or four of us putting things together. This takes an entire circle of support. And in our case, research came to aid. You see wonderful names on the slides, and these are the collaborators we work with. So Sam3 coming from Carleton Breer have in fact helped us with our first initiative in Canada, which was our wellness monitoring program. And what we're also excited about is the work we're doing on smart technology for aging in place for Breer Research Group. And come check us out. We're going to have a panel that we're going to talk about just that. A wonderful venture we're in the midst of. And of course, CTAN out of UNBC, another innovation hub, they're supporting us learn what it means to have digital literacy in remote areas. So they're in northern BC, if you're not familiar, and getting access to anything is super difficult in that space. So those are, I know, some of the research collaborations that we're working on with awesome outcomes. I don't know how validation would have come to us without such collaborations. And of course, we learn. If you go to the left-hand side, we got amazing partners. I didn't want to pollute this slide, but just to show some of the names where some of the pearls of wisdoms came from, do not do lists came from, or focus on the areas that actually are the gaps, came from. So I'm very grateful to the partnerships and collaborations that we had alongside with our healthcare collaborators and partners at the bottom. At the very bottom of the slide is without technology that comes from these wonderful entities, we wouldn't have much to offer for the second service offering. So I do thank you, vendors, if any of you on this call, for just showing up for this space, because we're all learning in this environment together. And massive shout out to all of our internal partners. It takes time, money, effort, sweat, new learning for a retailer and a service provider to step into the space. And we couldn't done it without our internal partners in this space, anywhere from legal all the way to logistics. And the game goes on, of course. I'm super grateful. Having said that, I left one factor out. So if you remember, I said one of the things the factors gets in the way is for the individuals when they're thinking about investing in technologies, does it help me? Well, that's exactly where AgeWell partnership made a lot of sense for us. I want to say we went go back about 4 years when we first met. It was my first time attending one of the conferences. I felt like I was drinking out of fire hose. There was just so much there. But point being is, it was the introduction was nice. They kind of embraced us as an industry to come in and learn. And all these wonderful benefits that I've lined on this slide are the things we've taken away and given back at the same rate to AgeWell. And I think the curation here is what helped us, fast forward some of our learnings and partnership making. So without which you probably would in the midst of trying to learn how Canada works. So major shout out to AgeWell. Couldn't have done it without you. So thank you very much for your continuous support. With that, I don't want to sound all smart on my own. This wonderful team that you see ahead of you is another piece of advice I have for everybody who's listening to me today. So do surround yourself with, diverse superpowers. There's no way I have all the ideas together by myself. My job, in fact, is to support this wonderful team you see ahead of you. And what I've done here is I've not only listed the backgrounds, but also their superpowers. So Henry Trung, he comes from the background of technology and services. Henry breathes, sleeps, wakes up with technology. So that is his expertise, and therefore he's responsible for putting the offerings together and making recommendations on technology. That's supported by Claire Andrews, a former occupational therapist, came from healthcare. We're super lucky to have her, who's working on the other end of spectrum, which is human needs analysis. As a former occupational therapist, she's familiar with home assessment, assessment of human needs, adaptation of the house, of course, and creating those solutions before it makes it to Henry as far as these are the human needs I need to go solve for. Can you help? And of course, Rachel Sturm sits on top of all that. Once this amazing collaboration is done, Rachel's job has become to come and create lessons that are free for individuals to start using them on their own, or for caregivers who can leave this with their older adults in order to adopt the solution for a longer period. So major shout out to my team. There's no way I could have done any of this without them. So thank you very much. Something about leadership style. Okay, so we're in kind of weird times. Okay, you watch the news, so much is happening in industry here and there, but I want you to know that EQ, emotional intelligence, never played a bigger role in this space. So it's a must in this space of high dose. If you're not born with it, please work on acquiring it. It is possible. And it kind of the leadership style that I've started picking up, and hopefully my team think I'm doing okay job in this space. But being a servant leader in this space is not a nice to have, it's a must have. If you don't know much about it, please look up Robert K. Greenleaf. He's the one who actually came up with this leadership style, is a founder of it. And most importantly, these are uncertain times. So do create psychological safety for the teams that are either reporting to you, working with you, whatever case may be. But because you've been doing what you've been doing, and because you're super smart in the space you're in, doesn't mean we can drive some of the agenda. Sometimes creating psychological safety means getting out of the way and letting the right thing happen, and just be support. There's absolutely nothing wrong with that. You'll be amazed how much flourishes out of your teams and peers once you start practicing some of that. But it's important for everybody to feel safe to express what they feel. And innovate for impact. At the end of the day, we're here to innovate for the greater good. So let's just keep doing the right things. When if trends are set, the change will prevail, right? So let's not wait for roads to be paved for us to get our cars on the road. Let's get going. Let's keep digging. It's okay to get our hands dirty. And let's keep talking about the same unicorn. Let's not have too many of them. Let's stick with the agenda, have a few verticals, and let's keep painting the same picture and go after it together. Together we have a bigger voice, okay? And I use this analogy a lot, but my team's probably laughing at me right now after watching, but I do invite everybody in Canada, no matter which industry you're from or which expertise you come from, bring your best to the picnic. Let's not bleed into each other's area. I'm not good at healthcare. A lot of you are. But we're good at tech. A lot of you aren't. So let's bring our best to the picnic. And picnic was that socialist view that I just started my presentation with. This effort does take a village, and I don't think holding the cards close to the chest will work for us in this space. And I'm so open to hear about, what's possible on your side. And we love to be a collaborative partner in a lot of what's possible in Canada. So with that, I do thank you very much for giving me the time. I went over a little bit of how much I wanted to say, but I do hope there was, some benefit to today's presentation. I'm super happy to take any questions. Thank you very much.
Wow. What can I say? That was so great. Thank you
Oh,
so much.
thank
As
you.
someone that is in accessibility, I gotta say that was awesome. Thank you so much, Sarah.
Thank you,
Um,
Ashley.
yeah, I do want to open up the question, so I will invite people. If you want to raise your hand, there's multiple ways we can do questions. So we can do it through the chat. We already have one in our Q&A. And also, like I said, you can use chat or just raise your hand and I will see that. But I will start with the question that was put into the Q&A. This is from Kitty. How would the persona you identify and solutions for testing be different or the same if your target audience are older adult caregivers?
Thanks. Great question, Kitty. And to be honest, we started when we started designing for older adults the entire time. So everyone was asking us, who's your target audience? Like, we're seniors, we're looking at older adults. And when Claire joined our team, being a former occupational therapist with a degree in inclusive design, is like, can we stop talking about age groups and can we just talk about needs? And we start designing with needs and let people come find their own needs with our solutions. So if we do a good job make it universal enough for people to see themselves in our solutions, then that's a job well done. And I'm not suggesting we've achieved that peak yet. But the hope is that we make it simple enough for everybody to see a solution, in it for them, whether they're themselves older adults or the caregivers, or even younger folks who actually happen to be in the care model. Hope that answers your question, Kitty.
Thanks so much, Sarah. We do have a hand up. Lorenzo, I'm going to allow you to talk on mute, so I'll give it to Lorenzo.
Hi, Lorenzo.
Hello, can you hear me?
Of course.
Hi, thank you very much. So Lorenzo De Carli from University of Calgary here. So
Nice to meet you.
nice to meet you. You mentioned initially that you find the Canadian context quite different from the US context. So as a researcher who spent many years in the US, I found this very interesting. And I was wondering if you feel comfortable elaborating a bit more on that.
For sure. I mean, I don't want to sound like an expert. The one thing we quickly found out was the big difference was the payers model, right? So how Canada's publicly funded, we do our best job to make it non-for-profit in Canada and, make sure everybody's getting a bit of this love that's called healthcare, where in US is highly privatized, right? So you may possibly see some higher quality of service, when it comes to health, but it's not for everyone and it's not as accessible. This means for technology or solution providers as a whole in Canada, the first people who are going to be interested in innovation are actually insurance companies, not necessarily healthcare, because it's not publicly or it's not funded the same way. It's not designed the same way Canadians are. So your customers is a bit different in US than it is in Canada. Actually, that's a huge difference by itself. I hope that answers your question, Lorenzo.
Yes, it does. Thank you very much.
My pleasure. Thank you.
Thank you so much, Lorenzo. Like I said, please put your questions in the chat. You can raise your hand. As people kind of are putting their questions together, I actually want to know, I really appreciate, Sarah, how you and your team discussed putting the human first, talking about how can we make older adults and caregivers that are maybe new to some of these technologies comfortable using them. And that's really a part of it, really understanding the digital literacy, but also like, what do they need? Something that you said in your presentation that you and your colleagues talk about is this kind of serial aisle of technology. I want to know maybe more if you could talk more about like how has Best Buy really kind of experienced how to make people that are really new to these technology comfortable. So we're in the serial aisle. How do we assure them what box to grab for, and to assure them their kind of nerves, if you will, about this kind of new world?
For sure. And we're not there yet. So we're getting there by starting about and talking about these things. Our immediate team, or at least our web offerings, are starting to become, good at asking, what do you need? What are you trying to solve for? As opposed to take them to the cereal aisle. It's almost like keeping them away from the cereal aisle before we understand what problems they're trying to solve for. And also giving them comfort. It's like, we heard this a lot. If your problem is similar to what we've already thought about, this is a one or two or three bundles that could work for you. And hopefully we can take that thinking away from them. To me, that's like a step into this like very messy lobby to say like, come on in, we can have a little chat at the doorstep. And then, and then I start talking about the solution, not in tech jargon, but in simple language. As I said, we are another retailer or service provider who's trying to get good at this. So please don't think you're going to step into Best Buy store. We're going to ask you what problems you're trying to solve for. But it is what we're trying, thriving at, and that's what we're trying to get good at. And I'm pretty sure we're going to get there. But it is that the fax dude who showed up, who showed you how to use the fax in your home. We're trying to be something similar to that without interrupting people in their home space.
Thank you so much. We
Okay.
have a question from the chat, which I don't know if I can fully answer, but I can definitely say how much our collaboration and partnership with Best Buy has meant to AgeWell. But Katrina wants to know what comes next for Best Buy and your partnership with AgeWell.
For sure. Well, we're gonna keep going as long as they're willing to have us. What's been amazing about our collaboration most recently is us trying to understand and separate two things from each other, which is love and appreciation of innovating solution, meaning hardware, and starting to get love and appreciation for innovation now being the service and the implementation side. So the fact that they allowed us to do that and create this new dimension around innovation has been quite amazing for us. So, and in fact, this is, our research with, we're a research group, a research institute where we're working on taking already developed hardware. So we're talking about the Googles of the world, the Philips of the world, but then how do we make that a holistic prescription for the home? And then with the support of OTs, can we validate the benefits of products that are going home? Because we're not going to be the ones showing up and asking those questions. It's not our place. And how do we then help occupational therapists think about this a little bit differently and hopefully at some point get back to the formal education? Without as well saying yes to it right at the gate, we could never explore what implementation of service meant in form of an innovation. So I think that's just it's, the beginning of a new genre.
And if I may, I just want to add that as someone that's been just starting with HL since July, just a situation like this, having Sara as a resource this is actually a webinar that is a part of our EPIC AT programming for a course that we're doing on policy, HTEC and policy. So just to be able to ask Sara for her time to give her knowledge and experiences in this field is so important. So I just want to say it's a very mutual relationship, and we're very lucky and happy to have our partnership with BestBuy Health, and the team with Sara. I have a question from Jeremy, and then I see another one in the Q&A. So I'll start with Jeremy. Jeremy says, great webinar, thanks. Any appetite to move into hospitals at home in Canada, like in the US?
Absolutely. We love to. I mean, that's something, it's just nobody has approached us yet from place of impact, right? So it's a great notion. Our parent company has acquired a wonderful company called Current Health. They've already signed their first partnership with healthcare, and it's great. I mean, my hope is that we understand what that means in Canada. And I know for the first time ever, we have this uniform approach to it, because I don't have to tell you how many regions and opinions exist in Canada, but I do hope at some point there's some sort of uniform agenda around that ask, where this also is should be a reimbursable model if you want people to stay at home and recover at home. But as soon as we understand at least what one province is asking us, we love to get into that discovery side of things, because that's a huge heavy lifting. But yes, we're interested. Please reach out to us if you're one of those decision makers. We'd love to know what that looks like.
Thanks so much, Sara. We actually have another question from Kitty, and then another one in the chat. So exciting. Kitty wants to know, how do you plan on integrating generative AI in BestBuy Health?
A very foreign topic to us yet, Kitty. Like, this is, I'm not going to beat around the bush on this. So right now, we're merely, just working on that human interaction with technology. We do have amazing partners and all these wonderful folks you see at CES, Consumer Electronics Show, happens once a year, who are working on AI side of things. We're not interested, at this point around what it could be, but we're definitely staying close to the awesomeness that it is about to bring. But right now, as I said, human in the center, we're just focusing around, bringing solutions to that immediate person right now, and validate the benefits. And we learn as AI comes.
Thanks so much, Sara. And thanks for the question, Kitty. We have another one in the chat from Bruce Clark. They ask, Sara, do you have any intentions to focus specifically on tracking frailty in the aging population?
I mean, that's a loaded question, and I would say we're not healthcare, right? I just want to make that very clear. Hence the picnic, right? But we do want to show up where the experts are identifying signs of frailty and its impact on one's life, right? And we want to show up at the place where solutions are being asked for. So yes, we do care about the journey of frailty. We're not the ones identifying them. We're here to learn about the human needs as it happens. And we like to be partners in the space of meeting the person wherever they are in their walks of life or in their aging journey. So I hope that makes sense. We like to be meaningful as learnings are offered.
Thanks so much, Sarah. I'll let people, we probably have another time for another question or two as people are typing. I wanted to know, especially for people that are maybe new to research and innovation in terms of maybe they're coming more with the technology side and they're trying to understand, how can I include like older adults? How can I really reframe the way I'm approaching my research, the way I'm approaching my work to include older adult needs first? What would be some of your recommendations to someone that maybe is trying to reframe their approach?
Great question. So for us to start with our why, we first had to understand what is our why and how are we going to go about it. And in order to come up with the hows and the whats, we had access to older adults. We were lucky enough to like do spot checks or temperature checks here and there. Is like, if I created 1, 2, 3, and if it did X, Y, Z for you, does that make sense? And those are the touch bases we have early on before we go, get all excited about what we're thinking. And we actually had to halt some of the programs as a result of those touch bases. And I gotta say, AgeWell also gives us access to older adult members that are pretty upfront with us on what they think is, and thank God, because we don't want to beat around the bush when you're developing programs. But I would say, yeah, just have a super open mind and do not worry about criticism. I had a mentor in the past that told me like 7 out of 10 criticism saves your butt. Be open to criticism, being criticized, and don't focus on what feels good for you or for your immediate family, because it might not be scalable as far as getting love from Canada is concerned.
Thanks so much, Sarah. Our last question I think that we'll have today is from Ava. Eva's actually one of our EPIC AT fellows and is doing amazing work in the field. Ava just said, thank you so much for the great presentation. She says, I was wondering if there are any privacy safeguards in place for health information.
Yeah, so Ava, we don't have access to electronic medical record, and the stuff that we sell, and when I call it stuff because they are already come with their own set of customer agreements, which is wonderful. Are already past the whole bunch of filters in that sense. But the most important part is the consent process that we go through in the home. So when we do arrive and the solution goes in, it's entirely up to the person who owns the technology, who's hired us, to give access to others outside their environments, whether if it's their PT, OT, nurse, son, daughter, neighbor, whatever. It's up to them, ask us how they can give what kind of access also matters. So we work with the decision maker along the way to show them the how, and we pretty much just stay away from opening it up to anybody else that's outside the, that consent process. And that's how we just kind of kept it to the individual. I hope that makes sense, Eva.
That was amazing. I really just enjoyed this presentation and webinar today for personal reasons because of my own background, but I also think this was such a great learning webinar for those that are really entering the field and also those that are already in the field, just to rethink about it. And I do want to thank Sarah for her time today. Thank you so much.
Thank
and
you.
I also want to thank her team because like you said, these things would not be without the work of a village. So thank you so much to her team as well. I want to thank all of you for coming today. This has been such a dynamic conversation and so timely. So thank you so much to everyone. I hope you have a great Wednesday, and we will see you at the next webinar. And thank you to Sarah.
Thank you, Asha. You're wonderful. Thanks for spending time with me today. Have fun.
Bye, everyone.
Bye.